Hi, Alan. So could you tell me a bit about yourself? And you're the founder. Can you tell me a bit about how you got started and what the benefits are?
Sure. So I got into hyperbarics kind of through trauma, which is often the case for people that use these types of technologies or get into it professionally. I was struggling with my sleep, at times going 5 or 6 days without any sleep at all. This is going back to 2019. It lasted for about 2.5 years. In that time, I was doing everything I possibly could to get better and improve my sleep. In fact, it became an obsession that I realize now, looking back, makes it even more difficult to sleep if you're obsessed by the concept of it. I tried so many different things: new age treatments, photobiomodulation, nano-V, pulse electromagnetic field. These are all things I didn't know about before, but I realized they were cutting edge treatments. And I did obviously all the kind of legacy treatments of kind of the sleeping tablets, all that kind of stuff. And on an obscure sleep podcast in America, I heard about hyperbaric oxygen. And at that point, I'd tried so many different things. I just thought this isn't going to work. And then went down to a place in St. Albans, about an hour away from here. And after I'd done it for an hour and a half in the chamber, I actually slept a bit that night. But I was like, well, correlation doesn't equal causation. I still wasn't convinced it was down to that. I went the following week and then I slept that night after, and I thought there's something in this. So I got a chamber at home, I sourced a chamber, and I got better. After 10, 15, 20 sessions, my sleep problems had gone. It improved my ADHD symptoms. And then I realized there were so many other applications across broadly health. So cancer, MS, post-surgery recovery, radiation sickness, all these other things that can be often related to cancer treatment. And I realized that there was an opportunity to potentially set up a clinic. So I used my chamber at home to do that. And then it grew, and I realized actually there's more scalability in actually renting and selling this equipment to people's homes and now businesses. And me and my business partner, Igor, we started Oxydise from that. And now we're the biggest distributor in the UK of hyperbaric oxygen equipment. So it's been a crazy journey, yeah. So some of the benefits are, it's what it's really doing holistically. A number of people use it for different reasons. So we've got athletes that we work with at the elite level. We've got people that are using it for longevity and biohacking. We've got people that are using it for really the razor's edge of their own survival with cancer. We've got those suffering with MS. And I would always say broadly, it's about increasing resources in your body to heal. So what's happening when you're in the chamber is it's lowering inflammation, it's increasing red blood cell count through angiogenesis, it's putting you into what's called parasympathetic nervous system, where you kind of relax, or breathe and feed, as they say, so you're kind of relaxing. So all that's happening while you're in there, and it's actually quite a therapeutic environment to be in once you're used to getting through that process of adjusting with your ears initially. But when you come out, some of the best things start to happen. So because you've had oxygen pushed deep into your blood plasma, you begin to off-gas that oxygen, and in that process it sends a mild survival signal to the brain that you're losing oxygen. So it starts to increase stem cells, which are the precursor cell to any other cell. It increases again red blood cell count. It increases BDNF growth factors in the brain to increase our number of brain cells and neurogenesis. And it again has all those inflammatory reducing pathways. So it has an unbelievable benefit. So whether you're fighting cancer, or you want to live a bit longer, or you're trying to do it for sports performance purposes, with our athletes, we start to see if you're stacking up 40, 60, 80 sessions, it actually increases your aerobic capacity. So it increases your VO2 max and how much aerobically you can put out into the world. So really significant, the benefits people receive.
Amazing. And I think it could also be really beneficial to women going through perimenopause and menopause.
Absolutely. So that's an area that we're looking to kind of create a bit more content around, specifically because it's a struggle that all women will go through. And we think it's a kind of market whereby people almost suffer in silence, particularly when they're working, they have all their other responsibilities around the family to upheaval. And it's not an easy thing, from what I understand, to go through. And this is a really good technology to kind of increase, again, those healing factors and reduce what you kind of get as symptoms. So yeah, exactly,
because it has a real impact on women's mental health as well, like foggy brain. I know we've spoken about this a bit already, haven't we? So executive functioning,
trauma, so like even stressed nervous systems, really good reactions with hyperbaric. And what we kind of find, where a lot of the science is anything neurological. So different pressures kind of have different effects on the body, but we find 1.5 ATA, which is about 16 feet of pressure, is actually optimal for like cognitive recovery. So even if it's neurological decline through Parkinson's or dementia, those kind of things. Like we see really good efficacy from that, and that starts by kind of just alleviating the brain by sort of reducing the inflammatory response. And I always remember, I know it's anecdotal, but when I was going through the worst of my sleep trouble, I constantly had a pressure headache around the front of my frontal lobe, which I realized is because essentially you're lacking blood flow to that region. That's kind of what makes it even sorer, and the inflammation. But that was the first thing that sort of reduced. After a couple of sessions, that went down, and then I'm able to sleep better, and it all just begins to recover. So yeah, it's all blood flow. A lot of these issues is perfusion, it's blood flow and oxygen issues. Yeah. But if you can relax someone's nervous system and get all those pathways reactivated and get them to heal, then all told benefit happens. So this is our red light bed. This is our premium red light product. So it's got 42,000 LEDs inside it, which range. So red light is a really interesting spectrum. It ranges from 600 nanometers to 1100 nanometers, which is near infrared. It kind of mimics a portion of what we get from the sun, but it's a bit more concentrated. So what this is doing in that range is 600 is more around the range of skin and wound healing. So a lot of the masks that people are wearing now, and they have got a 600 or 633 nanometer bulb in them, and that's more acting on the surface, the dermal layer of the skin. And then actually as you go deeper, so you start going 700, 850, you're getting into the mitochondria, which is, everyone says, is the powerhouse of the cell. And then when you go to 900, you're getting into deep cellular kind of organ regeneration. Now this covers that whole spectrum. It's got 5 red light frequencies that go to near infrared, and that kind of acts on your biology differently from that kind of spectrum I'm describing. But if anyone's watching this and they've got one of the masks, one of the things I'd advise is look to see if it's got an 800 nanometer wavelength bulb in it as well, because what you need, that acts on your collagen production, your fibroblast soft tissue production. And because we're not just about our skin, because creams only go so far, and we all realize that we are kind of inside out beings. That's what radiates our skin. It's generally how well we are as an organism, not how well our skin's looked after. So that would act on the fibroblast production that increase your collagen production. So that's kind of, you want those 2 wavelengths in the mask. But yeah, it's a really high quality piece of kit. Something of this size and power, you do not need to use that frequently. So these can go into clinics, they can go into quite wealthy people's homes. And we would always say this is actually different from a panel, in a panel could be used daily. You don't really need to, I'd say 3 to 5 times a week. But something like this, I would say putting more twice a week, because actually what we find with red light and where the science is going is it can show all these increases in energy in your ATP, it can lower inflammatory markers, it can give you that clearer head and a bit more energy, but you can see that for as long as 3 to 5 days afterwards in our biology. So you don't need to necessarily be doing it every day.